Imagine this. It's a perfect sunny afternoon. Maybe you're outside with your dog or your cat's lounging nearby, enjoying the warmth. Seems lovely, right?
Absolutely. But that lovely warmth, well, it can flip the switch surprisingly fast.
Yeah, and become a genuine danger for our furry friends.
Exactly. So today we're doing a deep dive into something really critical: heat stroke and hyperthermia in dogs and cats.
We're drawing on expert veterinary information here, looking at the core issues.
And crucially, figuring out how you can protect your pet.
Our mission today is pretty straightforward. Give you the essential knowledge, but, without making it totally overwhelming.
We want to pull out the really critical facts about this serious condition.
So you feel informed and ready to act if you ever need to. Okay, let's jump right in. What exactly is hyperthermia?
Okay, so in simple terms, it's an abnormally high body temperature.
High meaning what, roughly?
For both dogs and cats, generally, anything above about 103 degrees Fahrenheit or 39 Celsius is considered hyperthermic.
It's a sign our body's struggling then.
Yeah, struggling to regulate its temperature properly.
And our source material mentions different kinds, right? There's fever, but that's not quite what we're focused on here.
Correct. There's a key difference. Fever, which is technically pyrogenic hyperthermia, is when the body's internal thermostat, the hypothalamus, actually resets itself higher.
Usually because of the illness, right?
Exactly, fighting off infection or something. But what we're talking about today is non-pyrogenic hyperthermia.
Okay, and that's different how?
Here, the body overheats because of outside factors like environment or exertion, but the thermostat setting itself stays normal.
And heat stroke is the really bad end of that spectrum.
Precisely. Heat stroke is the most severe form of this non-pyrogenic type.
And it's not just like they feel a bit hot, is it? The info we have really stresses how serious this gets.
Oh, absolutely. Heat stroke happens when their own cooling systems, panting, etc., just get completely overwhelmed by excessive heat.
And then what?
It kicks off this really rapid, dangerous cascade of events inside their body. It can lead to multiple organ systems failing.
Multiple systems, wow.
Yeah, and the sources point out a critical threshold. Once that core body temperature hits around 109 Fahrenheit or 42.7 Celsius, the risk of widespread organ damage just skyrockets.
Okay, so we know it's incredibly serious, but let's get down to basics. What is actually happening inside their bodies when heat stroke takes hold? The pathophysiology.
Right. So the key thing, unlike a fever, is the brain isn't telling the body to get hotter. It's just being swamped by external heat.
So it's an outside force causing the problem.
Exactly. And this extreme heat causes direct thermal damage. It literally damages cells.
Just cooks them, essentially.
In a way, yes. Cells start to die. That's necrosis. Tissues don't get enough oxygen, hypoxemia, and really crucial proteins start to break down or denature.
It sounds bad enough on its own.
It is. And all this intense cellular stress can then trigger a massive body-wide inflammatory reaction. It's called SIRS, Systemic Inflammatory Response Syndrome.
Like the body attacking itself almost, a runaway inflammation.
Kind of, yeah. It's a massive, uncontrolled inflammatory response.
So it's like this awful chain reaction of damage then.
Yeah.
And our sources actually detail which systems get hit hardest, don't they?
They do. Let's walk through it. The effects are really widespread.
Okay, where does it start?
Well, think about the cardiovascular system. Their blood volume can drop dangerously low. That's hypovolemia. Puts a huge strain on the heart.
Leads to heart issues.
Definitely. You can see irregular heartbeats, arrhythmias. And the heart muscle itself can actually get damaged from the lack of oxygen, ischemia, and necrosis.
Okay, heart problems. What else?
Then there's the gut, the gastrointestinal system. The lining can get damaged because blood flow is reduced there too.
That sounds awful.
It is. And it's dangerous because it can allow gut bacteria to leak out into the bloodstream.
Oh, wow. So infection on top of everything else.
Potentially, yes. Bacterial translocation and something called endotoxemia, really serious complication.
This is just layer upon layer of problems. What other systems are affected?
Well, the blood itself, it can actually get thicker hemoconcentration, and their platelet count can plummet, thrombocytopenia.
Platelets are for clotting, right?
Exactly. So low platelets plus other factors can lead to serious, widespread clotting problems. We call it DIC, disseminated intravascular coagulation.
DIC, I've heard of that. It's really bad news.
Very bad. Then the liver can suffer major cell death, hepatocellular necrosis. Muscles can start breaking down, rhabdomyolysis.
Muscles too?
Yep. And the nervous system is highly vulnerable. nerve cell damage, bleeding inside the brain, even brain swelling, cerebral edema.
Oh my goodness.
And finally, the kidneys. They can be hit hard, potentially leading to sudden, acute kidney failure.
It's almost unbelievable how many different parts of the body are affected. It just hammers home why getting help fast is so critical.
Absolutely.
So who is most at risk? Are there particular pets we need to be extra careful with?
That's a really important question. Now, technically, any dog or cat can suffer from heat stroke.
But some are more likely.
Yes. It seems to be less commonly reported in cats, for instance. But breed is a huge factor for dogs.
Which breeds?
Animals with long, thick coats, obviously. But critically, and this comes up again and again in the sources, the brachycephalic breeds.
Those are the short-nosed ones.
Exactly. Your pugs, bulldogs, Frenchies, boxers, and similar cat breeds like Persians. Their anatomy just makes it physically harder for them to pant effectively and cool down.
So their built-in cooling system is already compromised?
Pretty much, yeah. Age is another factor. Very young animals.
Puppies and kittens.
Right. They might just overdo it, push themselves too hard playing. And then older pets, who often have other underlying health conditions.
Makes sense. So it's about breed, age.
Yeah.
What else? Are there health or environmental things that increase risk?
Absolutely. A big one is having a previous history of heat-related illness.
Once it happens, it's more likely again.
Significantly more likely, yes. Other things include not being used to the heat, poor acclimatization, being overweight is a major one.
Obesity, yeah.
Poor general heart and lung health. Hyperthyroidism, especially in cats. Any existing heart or respiratory disease, obviously.
We mentioned thick fur already.
Thick fur, yes, and simply being dehydrated. Not having enough water makes it harder for them to cope.
Okay, knowing the risks helps us be more watchful. But how do we actually spot it happening? What are the warning signs we should look for?
Well, the sources talk about two things. The situation, the history, and then the physical signs you actually see.
Okay, so what kind of situations should set off alarm bells?
Think about any time your pet has been in a hot environment. The classic tragic one is being left in a parked car, even for a few minutes.
Never, okay.
Never. But also poorly ventilated rooms, conservatories, even grooming accidents with cage dryers if they overheat.
Right, those dryers can get hot.
They can. Also, really strenuous exercise, especially in hot or humid weather, and not having easy access to water.
And what about pre-existing conditions?
Yes, definitely be extra vigilant if your pet has known breathing issues, like laryngeal paralysis or that brachycephalic syndrome we mentioned, or heart problems, nerve or muscle disorders, or, as we said, if they've had heat stroke before.
Okay, so those are the circumstances. What about the actual physical things we might see?
Early on, you might notice really excessive, frantic panting and lots of drooling hypersalivation.
Obvious signs of overheating.
Yes. And their temperature, if you could take it, would be very high. Check their gums. Initially, they might look bright, almost brick red, hyperemic.
Bright red gums, okay.
But as things get worse, those gums can turn pale or even grayish or bluish. That's cyanosis, lack of oxygen. Big danger sign.
What else?
You might feel their heart racing, tachycardia, maybe an irregular rhythm, dysrhythmias. They might show signs of shock weakness, collapse. Trouble breathing is common.
Breathing difficulties, okay.
They might start vomiting, maybe even with blood in it, hematemesis, or have bloody diarrhea, hematochezia, or melena.
Oh.
You might even see tiny pinpoint red spots on their skin or gums. That's petechiation, indicating bleeding issues.
And their behavior?
Changes in mental state are really critical. They might seem confused, disoriented, wobbly, uncoordinated, that's ataxia, or just really lethargic.
Not themselves at all?
Not at all. And in severe cases, you can see muscle tremors, seizures. Sadly, they can lapse into a coma or even suffer respiratory or cardiac arrest.
These are all just incredibly alarming signs. Really drives home the urgency. So what are the direct causes? What actually triggers this cascade?
The number one cause, overwhelmingly, is exposure to excessive environmental heat and humidity.
So hot weather, basically. Or accidents.
Yes, either the weather itself or being accidentally confined somewhere hot, like that car scenario, or a shed or attic.
Those airway issues we keep mentioning.
They're a huge contributing factor. Anything that makes it harder for them to pant effectively increases their risk dramatically.
Makes sense. Anything else?
Strenuous exercise in hot conditions is another big one. And then, less commonly, certain toxins that cause seizures, like strychnine or metaldehyde slug bait. The intense muscle activity generates heat.
Right.
And there's a very rare reaction to anesthesia called malignant hyperthermia that can cause a massive spike in temperature.
No, okay. So let's say we suspect this has happened. We see some of those signs. What is the absolute first thing we must do? And how does a vet figure out if it really is heat stroke?
Okay, diagnosis first. The source suggests that if you have a pet with a really high temperature, say over 106 Fahrenheit, 41 Celsius, and there aren't clear signs of infection.
Like coughing, sneezing, things like that.
Exactly. If those are absent, heat stroke should be very high on your list of suspicions. It's also interesting that heavy panting and drooling we often link with fever might actually be less obvious sometimes with this non-fever type of hyperthermia.
Huh, okay. So top priority action.
Immediate cooling. Start cooling them down right away. Don't wait.
So that's the best way.
Use cool water, emphasis on cool, not ice cold. You can spray them down, gently immerse them in cool water, like in a tub or sink if they're small enough.
Spraying or immersing, okay.
Use fans to get air circulating over them. Convection cooling helps a lot. You can also put small amounts of rubbing alcohol on their paw pads, armpits, and groin. The evaporation helps pull heat away.
Alcohol on the pads and friction spots. Got it.
But UT, and this is absolutely vital, you need to monitor their temperature while you're cooling them.
Why is that?
Because you need to stop actively cooling them once their temperature drops to around 103 Fahrenheit or 39.4 Celsius.
Stop at 103. Why stop?
Because they can keep cooling even after you stop, and you risk swinging too far the other way and causing hypothermia, making them dangerously cold. That creates a whole new set of problems.
Oh, okay. Avoid the overshoot. Cool them down to 103, then stop active cooling.
Exactly. And after you've started these initial cooling steps, getting them to a veterinarian immediately is non-negotiable. It's an absolute emergency.
Right. So you get them to the vet. What kind of treatment happens there?
At the clinic, the veterinary team will take over the stabilization efforts and start aggressively managing all those potential complications we talked about.
What does that involve, typically?
They'll likely give oxygen therapy. If the pet's struggling to breathe, they might need help keeping their airway open, sometimes even needing to be intubated and put on a ventilator.
Mechanical breathing help.
Yes, in severe cases. Intravenous fluids, 5E fluids, are absolutely critical. They help combat shock, dehydration, and support circulation.
Fluids, oxygen, what else?
Then they'll treat specific problems as they arise. Medications for seizures if they're happening, treatments for those clotting problems, DIC, support for damaged kidneys, maybe treatments to reduce brain swelling.
Tackling each complication.
Exactly. And they'll also look for and manage any underlying conditions that might have contributed. Hospitalization is almost always required.
Not usually an in-and-out visit, then.
Definitely not. Often they need intensive care, sometimes for several days, to manage everything.
You mentioned avoiding ice water earlier. Are there other important do's and don'ts when dealing with heat stroke? Critical things to remember?
Yes, absolutely. That warning about ice is key. It seems intuitive, maybe, to use ice.
Plunge them in an ice bath.
Right, but you shouldn't. The extreme cold actually causes the blood vessels near the skin surface to clamp down vasoconstriction.
And that's bad because?
Because it traps the heat deeper inside the body's core, making it harder to cool them down effectively. Stick to cool or tepid water.
Cool, not ice. Got it. Anything else to avoid?
Shivering. If your cooling makes them start to shiver, you've gone too far or too cold. Shivering actually generates muscle heat, which is the opposite of what you want.
Okay, so avoid ice and avoid making them shiver. What about medications? Is there like a specific drug for heat stroke?
Interestingly, no. There isn't one single magic bullet drug for heat stroke itself. The treatment really focuses on supportive care and managing that whole cascade of symptoms and organ complications.
So treating the effects, not the root cause, directly with a drug.
Pretty much. However, vets might use broad-spectrum antibiotics.
Why antibiotics if it's not an infection?
It's often given prophylactically as a precaution because of that risk of bacteria leaking from the damaged gut we mentioned earlier, trying to prevent sepsis.
Ah, makes sense. Preventative measure.
Ah.
And what about drugs for those specific complications? You mentioned treating seizures and kidney issues.
Right. The source material gives some examples. For kidney failure support, they might use drugs like dopamine. For brain swelling, mannitol is a common choice.
Okay.
If there are dangerous heart rhythm issues, lidocaine might be used. For seizures, diazepam is often the go-to.
Standard seizure drug?
Yep. Sometimes, very cautiously, they might use sodium bicarbonate if there are severe metabolic acid problems. For the DIC clotting issues, they might need plasma transfusions or heparin.
Complex stuff.
It is. And if there's severe vomiting or diarrhea with blood, they might use a combination of antibiotics and drugs to protect the stomach and intestines.
So lots of potential interventions depending on what's going wrong. There's drugs that are specifically not recommended?
Yes. Anti-inflammatory drugs like NSAIDs, think ibuprofen-like drugs for pets, are generally not used for heat stroke.
Why not? They reduce inflammation.
Right. They do, but remember, in heat stroke, the body's internal thermostat, the hypothalamic set point, isn't reset higher like in a fever. NSAIDs work by lowering that set point. So they don't address the core problem here, and they can have side effects, especially a risk to the kidneys, which might already be struggling.
Okay, so NSAIDs are out. Anything else?
The use of corticosteroids, like prednisone, is controversial. Some sources say maybe in specific shock situations, others warn against it due to potential risks like worsening gut issues or masking infection. So it's debated.
Good to know. And just to reiterate, avoid ice for cooling.
Absolutely. Cool water, fans, evaporation, no ice.
Okay, so let's say a pet gets through the initial crisis. They survive. What does the future look like? What's the prognosis? And what kind of follow-up care is needed?
The prognosis, unfortunately, is quite variable. It really depends heavily on a few things.
Such as?
What caused the heat stroke in the first place? Was it just overexertion or being trapped somewhere? How high did their temperature get and for how long? Critically, how quickly did they receive effective cooling and veterinary treatment?
Time is everything.
Everything. And then, did they develop severe complications along the way? Especially things like acute kidney failure or that DIC clotting disorder. Those significantly worsen the outlook.
And does having it once affect them long-term?
Sadly, yes. Our source indicates that a previous episode of heat stroke can make an animal more susceptible to it happening again.
Oh dear, why is that?
It's thought that the extreme heat can cause some lasting damage to the body's thermoregulatory center in the brain, the system that controlled body temperature. So they might not be able to cope with heat as well in the future.
So ongoing vigilance is key. What about follow-up?
Close monitoring is essential, both during the recovery period in the hospital and after they go home. This means keeping a close eye on their vital signs, doing repeat blood work to check organ function, monitoring urine output.
I'm looking for lingering damage.
Exactly, and watching for any potential long-term complications.
Which could include?
Things like ongoing heart issues, maybe arrhythmias, other organ dysfunction, liver, kidneys, persistent neurological problems like seizures or changes in behavior. Chronic kidney disease is a big risk.
And that increased risk of it happening again.
Yes. Plus, there's always a risk, even later, of things like systemic inflammatory response syndrome, SIBIRS flaring up again, sepsis, lung injury, ongoing muscle or liver damage, or even sudden cardiac or respiratory arrest down the line in some severe cases.
Wow, it really highlights that surviving the initial event is just the first step. The potential for long-term consequences is significant.
It really is.
This has been incredibly thorough and honestly quite sobering. If there's one core message, one critical takeaway you want everyone listening to remember, what would it be?
I think the absolute most crucial thing is this. Heat stroke is a genuine, life-threatening emergency. It progresses incredibly quickly.
No time to waste.
Zero time. It demands immediate recognition, very rapid action on your part to start cooling, followed by urgent, immediate veterinary care. There's no wait and see with this.
Recognition, cooling, vet. Got it.
And prevention, of course, is always better than cure. Be intensely aware of the signs we talked about. Know how to start cooling your pet safely and effectively. Understand you need to get them to a vet without any delay.
And that prior history point.
Yes. And please remember, if your pet has suffered from heat stroke before, they are definitively at a much higher risk in the future. You need to be extra cautious with them in warm conditions.
Okay. So thinking about everything we've just covered, the speed this happens, the sheer range of damage it can cause inside the body, those potential long-term health issues. Here's something for you, our listener, to really think about.
What practical, concrete adjustments can you make in your own routine, especially as the weather starts to warm up? How can you proactively safeguard your specific pet's well-being and genuinely try to avoid these terrible risks altogether?
That's the question we'll leave you with, something to really mull over after this deep dive.